And can you go into that for someone listening that's saying, well, I don't get it. I have high levels of mercury. I've done the tritide or other things. I know this. And I was told I should just chelate because that gets it out of my system. Can you go into the importance of really getting the organs of elimination right? And maybe even go through some of the products that can do that from Quicksilver?
Yeah. So you got a high level in the body and you want to get it down. But why do you have a high level? You have a high level. It's a combination of exposure and low excretion, low detoxification. And how does detoxification work? Now, if we look at mercury coming out, you've got the cell, you've got compartments. You've got the cell going to the blood and then excreting out. And it's excreting out through the liver to the bile. So really big one. We're going to hit this multiple times because the transport of the liver of toxins from the liver to the GI goes through bile transporters. So if you're not moving bile, you're not moving toxins. So you've got cell, blood, bile, GI, or cell, blood, kidneys into the urine. And in the kidneys, it's the proximal tubules, and they're active transporters. We think of glomerular filtration rates, creatinine clearance rates. But the kidney, you've got the glomerulus, moves a crude filtrate down to the proximal tubules where you remove the water, the amino acids, the peptides, a couple other things, and you dump the toxins in. Same transporters in the kidney that are in the liver. So, and then I said blood. Blood is really blood and lymph. So the cell dumps into the extracellular matrix, which moves into the lymph that then moves into the blood. So you've got toxins moving through lymph, moving through blood. From blood, they get excreted out into the organs of elimination. Some of the lymphatic stuff goes direct into the GI. So you got to take care of all of that. And you think it's just the metal is doing things wrong. But if that's not all working, that means one, at a cellular level, you probably got a poor detoxification system. That's poor glutathione system. And there's a whole bunch of things. There's a toxin. There's a phase one. You got to create an ability to stick glutathione or another molecule onto it. And then that's called phase two, the sticking. And then the transport is the movement through all these doors. If you don't have that happening, then the cells are built up with toxins. Also, if that's not happening, then the glutathione system is low, and the glutathione system is not feeding the immune system because it's not just detox, feeds the immune system, means your immune system is low. It's feeding telomerase. And so telomerase is low. When telomerase is low, you're aging at a rapid rate. You're going to have mitochondrial dysfunction. You're going to have senescent cells. Senescent cells are cells that don't grow but spread inflammation. So at a cellular level, you have all this decay happening. That's why, part of why you're accumulating everything. Then at this transport and this drainage level, this ability to move bile out and bring the toxins out with it, if that's low, you have a big systemic accumulation, not just of mercury, but of all the super toxins you're exposed to. And you're not feeding bile into your upper GI. And bile in your upper GI is bringing glutathione for detoxification reactions in your upper GI. And it's washing away. Bile is a detergent. And it's there to emulsify fats from your diet. And in doing so, it's also washing away bacteria from your upper GI. We'll talk about probiotics and stuff, but those are lower GI things. The upper GI is a chemical reactor. And when the bacteria get into the upper GI, that's called small intestinal bacterial overgrowth. And bile is washing that away. So bile's doing all these things, bringing toxins out, digesting food, and detoxifying and washing away bacteria. And so you don't have that going. And then in the kidneys are moving all of these toxins out. The kidneys are controlling sodium, potassium. They're controlling blood pressure. And if they're not working well, you have accumulation of all these toxins, more water-soluble toxins for the kidney, fat-soluble for the liver, and all that stuff is building up. So opening all that up isn't just take the toxin out. It's repairing things at a cellular level. It's repairing. If actually, when you go into these, the compounds you take for that, they actually repair the mitochondria. They repair the cellular space. They take you out of senescence or get rid of senescent cells. They open up the transporters into the lymph and blood. We're going to move lymph and blood. We're going to drain kidney. We're going to drain liver. We're going to fix all these systems. And when you do it naturally, all that comes with it. Versus, all right, all this stuff's blocked. In the middle is all these metals, and I'm going to throw the chelator in there. You haven't done anything to help up here, and you're then moving metals from places where they were stuck and maybe a little safer, and now maybe more get into the mitochondria, more get across the blood-brain barrier, more land into a damaged liver, more land into a damaged kidney, and stuff doesn't come out, and you're just hurting all of this already impaired or broken system.
Yeah, it's really like a reductionist approach when you hear about doctors that just hear heavy metal chelation, heavy metal.
It's a black box approach. You're a black box. There's metal in there, chelator in, metal out. Why didn't it work?
Right. Or why did it even make it worse? And then you feel like something else is there.
Why are they sicker?
Yeah. Yeah.